Hi, this is Zoe from Carepatron. Before you watch this video, don't forget to like and subscribe for more content like this. A suicide risk assessment is a vital tool that mental health professionals use to determine if someone is at risk of harming themselves or considering suicide. The assessment involves asking detailed questions about the individual's thoughts, plans, and behaviours related to suicide. The goal is to understand how severe and immediate their risk of suicide might be, which can help in deciding on the right help or intervention. The assessment explores many factors including feelings of hopelessness, past suicide attempts, access to ways of harming themselves, and whether they have supported people around them. It also considers protective factors, a person's strengths and resources like coping skills which can help reduce their risk of suicide. Suicide risk assessments are critical in making decisions about immediate safety and long-term treatment plans, helping healthcare professionals provide well-rounded individual care. To use our free suicide risk assessment, follow these steps. Download our suicide risk assessment from the Carepatron platform, which you can find in the link in the description. The process begins with some basic questions to identify if someone might be at risk of suicide. It's a quick preliminary check to spot any immediate concerns. Next, the professional digs deeper into various areas, such as the person's thoughts about suicide, any plans they might have, previous suicide attempts, their access to ways of hurting themselves, and any protective factors they might have, such as support networks or coping strategies. Next, the assessor carefully reviews all the collected information. The aim is to understand how immediate and serious the person's risk of suicide might be. Finally, a safety and treatment plan is created based on the assessment. This involves working together with the individual to develop ways to improve their safety and manage any identified risks. A printable suicide risk assessment can be beneficial during this step, ensuring all essential areas are covered and recording the person's response. The overall goal is to provide the best possible support for the person at risk, ensuring their immediate safety and setting up longer-term strategies to help them manage their situation. Here is a sample of our suicide risk assessment, which you can find on our Carepatron platform. To find our suicide risk assessment, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. If you are struggling with thoughts of suicide, do not be afraid to seek help from your local suicide crisis line. In our description, we have a link with a list of the International Suicide Hotline. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.